Hello, and welcome to my presentation on aromatherapy for respiratory illness. This presentation was made for Herzing University, Nursing 560, Research Methods and Evidence-Based Practice. The agenda we'll cover today is the background, an introduction, the evidence-based practice problem, the PICO question, the overview, the search strategy I used, any changes to implement future practice, opportunities for the future in research, and the conclusion. During my undergraduate at Marian University in Fond du Lac, Wisconsin, I learned about being a holistic, patient-centered nurse. Patient-centered care is looking at the patient as a whole, including their physical, mental, spiritual, and social needs. You also want to include the patient's family if your patient allows. The best way to help your patient is holistic care combined with comfort. For more information on holistic care and comfort for your patient, Kolkata's comfort theory would be a good theory to look up, but that will not be discussed here today. Aromatherapy is becoming more popular in Western culture, and more people are inhaling particles using a diffuser to relinquish their ailments. This review will look at certain essential oil studies to see if the effects related to the patients who have respiratory illnesses. In this presentation, we are going to look at several double-blind, randomized clinical trial studies to test the validity of the aromatherapy that is used in an aerosol component related to the independent variable and the interaction with the independent variable on respiratory illnesses versus the group that does not have an intervention to reduce the symptoms or the time related to the upper respiratory illness. The participants will be in a clinic or other similar settings, or they will be studied closely under clinical expertise. All participants will be called patients. The dependent variable will be generally defined as the study group, and the independent variable will be the placebo group. PICO question. What is a PICO question? It stands for Patient Intervention Comparison Outcome, and sometimes they use time. My PICO question is, will adult patients with respiratory illness using aromatherapy have a reduction in symptoms or a shorter time with the disease than adult patients who do not use the aromatherapy? I broke down my study into two components. I found halotherapy was a huge part of respiratory illnesses and treatments, and then I also broke it down into essential oils. So you can see in the following graph, a systematic review of studies was looked at on halotherapy. This included 6 different studies. In Hedman's study in 2006, the study was done on asthma. The scientists used a randomized controlled trial and 32 patients who had asthma. The patients were randomly assigned to either the placebo group or the study group, and they were in a room with a generator 5 times a week for 40 minutes for 2 weeks. The end results was a significant improvement in the amount of air breathed over 1 second. Another study in 2012, they looked at asthma and COPD patients, and there was 128 patients in this study, and it was a randomized double-blind single crossover trial. The single crossover trial means that the placebo group was able to participate in the study group. The patients used a salt inhaler for 20 minutes a day for 4 months. A significant improvement was found in all areas, including lung capacity, the amount of air breathed out over 1 second, and the peak expiratory flow. The next study was a cohort study with 67 COPD patients. The patients were separated into 3 groups. Group 1 had 20 sessions of halotherapy in salt chambers for 45 minutes over 5 weeks. Group 2 inhaled an isotonic saline 3 times a day for 5 weeks. And Group 3 was the placebo group. Both the study groups had a significant difference in their walking distance and the amount of air breathed over 1 second. Breathed out over 1 second. The halotherapy group also had improvements in their St. George's Respiratory Questionnaire. The halotherapy was tolerated over the saline inhalation. Another study used 52 mild asthma patients with randomized double-blind controlled study. The patients were in a salt room with a halo generator for 7 weeks and 14 sessions. Again, there was a significant improvement in the questionnaire and the broncho hyperresponsiveness. A study in 2017 used 34 mild to moderate asthma patients in a randomized crossover trial. They had 2 groups who received salt therapy in a salt room for 1 hour 3 times a week for 3 weeks. The results were also significant with the rising morning and evening peak expiratory flow rates after 2 weeks of therapy. The last study I looked at with halotherapy was an asthma and allergic pathogen study. This included 19 patients, and it was a case control group. The patients were at home using halotherapy monitored by the doctors. The results of this study showed a reduction in sensitivity, and the halotherapy became a healing mechanism. It also triggered an anti-inflammatory effect. Now we will move from halotherapy, where the results are effective with asthma and COPD patients, to inhaled essential oils. Due to my PICO question about using inhaled essential oils aromatherapy, we'll be talking about the results of the menthol in this study of the COVID-19 patients, but the eucalyptus needed to be thrown out due to it being encapsulated and swallowed by the patients. Menthol is not recommended with COVID-19 patients due to the ability of menthol to reduce the self-perception of dyspnea, and that can lead to the patients underestimating the severity of their disease and getting a delay in the medical treatment when it's needed. An essential oil spray study, there was a total of 60 patients in a random double-blind control study. They used Pearson's square test and Fisher's exact test to detect any differences in the variables between the 2 groups. And then the placebo was 1 group, and then 5 essential oil throat spray was another group. In the first 3 days of this treatment, there was a significant improvement in this study group, but after the first 3 days, there was no difference between the 2 groups in this study. Mitral study was done in a double-blind, placebo-controlled, randomized controlled trial. It's a synthesized review. They started looking at 236 citations, and they narrowed this down to 7 citations. However, the last 7 citations used a capsule formulation, and this study had to also be thrown out at this time. Okay. Okay, below you will see several search topics I used to find the research I needed. There were several articles on this topic, but really not a lot. I went to the school's online library, used the database CINAHL, and from that I needed to determine the terms that I wanted to search. And I knew I wanted the aromatherapy topic and related to any respiratory illness. Some of the terms I used are down below. But that is not an all-inclusive list of what I had used to find the articles I needed. I determined that not all the articles that I had aerosol in the essential oils. Most of the articles I did find had swallowed or ingested herbal medications or vitamins, and this narrowed down my search quite a bit. As you can see, searches can be endless for the content words and for the words the authors are using in their studies. If I were to implement this process, I would want to find out more information on halotherapy. I would also want to know if it's safe long term. I would also need more information on essential oils and how safe they are, the right potency to use, with the right patients, and what type of illnesses each essential oil works on. Upon doing my research, I have discovered that not many articles I could find from our school database on inhaled aromatherapies. I believe this is from aromatherapy not being used wide practice here in Western medicine yet. The articles ranged from using halotherapy, inhaled salt rooms and caves, to herbal and mitral. The three articles included aromatherapy, examined the study would be considered as an alternative method of healing. Mitral can reduce the symptoms of acute respiratory infections of viral origin in humans, namely acute sinusitis and acute bronchitis. However, that was pill form or capsulated. And then the most interesting study I found was to treat COPD and other respiratory illnesses using halotherapy. According to the Yoga Journal, halotherapy dates back to Europe to the 19th century, when a Polish physician recognized that salt mine workers he was treating had very healthy respiratory systems. The study I reviewed related to halotherapy concluded halotherapy was found to have a positive effect on patients suffering from chronic respiratory diseases. They improved the mucociliary elimination and the lung formation in common chronic respiratory diseases, and also health-related quality of life. So if you look at asthma patients or COPD patients, halotherapy is really good for them. If I were going to continue my research on this topic, I would investigate capsules, due to finding a lot more research out there on swallowed essential oils or swallowed medications, aromatherapies. Or I look at mitral for components in the inhaled form. They use some lemon and eucalyptus in the pill form. From the presented studies, we already know that halotherapy is very effective. I wonder why it hasn't been implemented into practice in the United States. It also seems very inexpensive compared to the inhalers that asthma and COPD patients use. Okay, so we don't have to go as extravagant as the halotherapy room on the screen for our patients. I doubt the insurance companies would pay for them. But why don't drug companies find a way to reproduce the halotherapy in the inhalers? As time progresses, we will see more essential oils being used in and out of our practices. More research must be done on essential oils and what brand, strength, and type will work for what illness. Plus, essential oils are not regulated by the Food and Drug Administration, so if patients just treated themselves without any guidance, they might be in the same trouble as the menthol study and not knowing when serious dyspnea is affecting them, and they would need to seek medical attention. Aromatherapy is not a new way of medicine. I have a feeling we will be seeing more and more herbal remedies used as the time goes on. Eastern medicine is much older than our Western medicine, which is pills and medication. As the world has a shortage of certain medications, opioids, albuterol, etc., I feel the patients will start filling in the gaps with other types of medicines and home remedies. When these patients come to me in my practice, I want to be able to have them practice safe remedies to the medications they may or may not have and adjacent to the medications they need. Let's all work for a safer future for our patients. Thank you for watching my presentation.